Did you know that pancreatic cancer takes more lives among seniors every single year than colon cancer? Yet, the vast majority of people over 60 have never received a single warning about its early signs. And here is what makes this reality even more dangerous. Those symptoms surface months before the disease becomes untreatable. Months. They are currently occurring inside people sitting at home right now who believe they simply require more sleep, that their back is acting up again, or that their stomach has been feeling a bit off. Right now, as you watch this, there is a high probability you have already noticed at least one of these 8 symptoms and dismissed it as something trivial. I am Dr. William Lee, and the information I am about to present over the next few minutes is something most seniors will never hear from their physicians, because here is the cold truth nobody tells you. Pancreatic cancer doesn't have an 11% survival rate because it is impossible to treat. It has an 11% survival rate because it gets identified far too late, every single time. Stay with me through all 8 of these symptoms, paying extra attention to the 5th one. That specific indicator has never once been on any checklist provided to a senior patient, but in reality, it should have been at the top of the list. Everything I show you today is building toward that one point. Now, before we explore the symptoms, I need you to grasp why this specific disease is so uniquely dangerous for older adults. You cannot feel the pancreas from the outside. Your physician cannot examine it during a routine checkup, and standard annual blood work will not detect this cancer until it has already metastasized. That is not a defect in our medical system. That is precisely why this disease succeeds so consistently. It hides inside the very symptoms you have been calling aging for years. Here are the 8 signals it leaves behind while it is still beatable. Pay close attention to every single one. Most seniors who notice their urine turning dark will simply do one thing: they drink more water. The urine becomes lighter for a day, they assume the problem is solved, and they move on. That assumption is exactly what costs so many people their lives with this disease. Here is what is actually happening inside your body right now. Your pancreas is situated right alongside a vessel known as the bile duct. This passage moves a substance called bilirubin from your liver into your digestive tract. Bilirubin provides the natural pale yellow color of your urine and the normal brown color of your stool. When a tumor develops in the portion of the pancreas called the head, it presses directly against that bile duct. It compresses it and it blocks it. When that happens, the bilirubin has nowhere to go. So it builds up. It floods into your bloodstream and your kidneys start working overtime trying to flush it out through your urine. The result is urine that shifts to a dark yellow, sometimes deep brown, or even the shade of strong tea or cola. And here is the critical detail that distinguishes this from basic dehydration. It keeps returning. You drink water, it clears, and then the next day, it is dark again because the blockage remains. The tumor is still there. Water cannot heal a tumor. This symptom appears before almost every other visible sign of this condition, and most seniors disregard it several times before they ever mention it to anyone. If your urine has been cycling between normal and dark for over 2 weeks, regardless of how much water you are drinking, that is not a hydration problem. That is a topic you need to discuss with your doctor this week. Not next month, but this very week. You now understand what dark urine is actually signaling, and that information alone could change the outcome of your next appointment. But the next symptom is more dangerous than this one, primarily because your physician has already diagnosed it in you. They have given it a name, and that name is entirely wrong. Your doctor likely called it arthritis, a pulled muscle, some recurring injury, or perhaps acid reflux, sometimes all 4 at once. While you spent your time addressing the wrong issue, the disease was buying itself more time. Here is how to know the difference. Pancreatic cancer pain possesses a unique signature. It begins as a dull, persistent ache in your upper abdomen, not the lower belly or the sides. Your upper abdomen just below the breastbone or slightly to the left, but it does not remain stationary. It travels. It radiates around your torso and settles in your middle back, creating a sensation that many patients describe as a band being tightened across their chest. This occurs because the pancreas is surrounded by one of the densest nerve networks in your entire body. When a tumor grows, it presses into those nerves, it invades the surrounding tissue, and those nerves send pain signals that radiate outward in every single direction. Now, here are the three specific factors that separate this pain from typical back pain. First, it worsens significantly after a meal. It isn't immediate, but within 30 to 60 minutes of eating, that pain amplifies. Second, it heightens when you lie flat on your back. Many seniors with this symptom wind up sleeping in a recliner or propped up on several pillows because they cannot endure the sensation of lying flat. Third, it does not respond to typical relief. You reach for ibuprofen, use a heat pad, or rest, but the pain returns exactly as it was because you are treating the symptom, not the cause. If this pain pattern feels familiar to you right now, you need to stop assuming it is your back. Tell your doctor the pain resides in your upper abdomen, radiates into your back, and worsens after meals and when lying flat. Those four details combined completely change the direction of your diagnosis. That distinction between pancreatic pain and ordinary back pain is something most seniors waste months figuring out on their own. Now you have it in 60 seconds. However, the third symptom is worse than both of those combined because this one is not just being ignored. It is actively starving your body as we speak, and you are sitting at your dinner table every night observing it happen without knowing what it implies. You sat down to eat, took 3 bites, and found you were finished. You set your plate aside and convinced yourself your appetite simply isn't what it used to be. That is not your appetite changing naturally. That is a tumor pushing against your stomach from the outside, physically compressing it. Your doctor has no idea it is occurring because you never mentioned it to them. Almost nobody links this to cancer. Not seniors, not their families, and sometimes not even the doctors themselves. When a pancreatic tumor enlarges, it extends beyond the organ. It presses against the surrounding structures, and since your stomach is positioned right in front of the pancreas, it compresses against it. When a tumor applies that pressure from behind, the stomach physically shrinks. Its capacity reduces, causing it to fill up with only a fraction of your normal food intake. At the same time, the tumor prevents the pancreas from creating necessary digestive enzymes. Without those enzymes, food sits in your stomach undigested much longer than it should. You feel overly full, your brain concludes you aren't hungry, and you stop eating. When you stop eating because you feel full after only 3 bites, you lose weight without trying. That weight loss often accelerates rapidly because your body also fails to absorb vital nutrients from the limited amount of food you do consume. Unintentional weight loss amounting to over 5% of your total body weight within 2 to 3 months represents one of the most critical warning signs in all of medicine. If you have dropped 10 or 15 pounds without changing your habits, that is not a blessing. That is a red flag. You now realize why 3 bites and full is never just an appetite problem. That single piece of information could be the difference between detecting this at stage 1 or stage 4 for someone watching this video. And I want to tell you something before we go further. Over 2 decades of treating patients, I have seen one symptom surface in nearly every single advanced case I have managed. Everyone experienced it, everyone overlooked it. I will show you exactly what it is before this video concludes. But first, the next 4 symptoms are what make the full picture come together, and the 4th one is already visible on your body, or that of a loved one, right now. Jaundice happens when bilirubin levels build up in your bloodstream until they begin to stain your tissues. Your skin acquires a yellow tone. The whites of your eyes discolor. In seniors with darker complexions, this is often most clear in the eyes and the palms of the hands. However, there is another layer to this that almost nobody mentions. Intense itching across your whole body with no rash, no apparent reason, and no relief from topical lotions or medications. This occurs because the bilirubin deposits in the skin and directly irritates your nerve endings. It is relentless, and it does not cease until you treat the underlying cause. Now, here is the dangerous aspect of jaundice, especially for the elderly. It looks identical to jaundice caused by simple gallstones. It's the same yellowing, the same dark urine, and the same itching. And because gallstones are extremely common in people over 60, this is the exact point where misdiagnosis happens. A doctor sees jaundice, assumes it is gallstones, prescribes initial tests, and the necessary deeper investigation gets delayed. Weeks drift by, sometimes even months. This is why you cannot just walk into your doctor's office and say, "You look yellow." You must arrive with the full story. Dark urine, pain in the upper belly spreading to your back, feeling full after barely eating, and now discoloration of the skin or eyes. That combination together tells a completely different, more urgent story. Do not let any single symptom get addressed in isolation. Hit subscribe right now if you haven't yet, and do not go anywhere because symptom 5 is the one that has sent seniors to the emergency room with life-threatening complications before any doctor linked it to their pancreas. This one has a body count. I need you to think about whether you or someone you know has dealt with a blood clot recently for no obvious reason, no recent surgery, no long flights, no cause anyone could pinpoint, because what I am about to explain changes everything about what that blood clot might have actually meant. Pancreatic cancer releases specific proteins into your bloodstream that drastically alter the way your blood behaves. Your blood becomes abnormally prone to clotting in situations and places where it really shouldn't. The most common location for this is the deep veins of your legs. Your calf or thigh may swell. It feels warm. It aches with a heavy, dull pressure that does not vanish when you elevate your leg or rest. And here is where it becomes critical. A fragment of that clot can break loose at any moment and travel through your blood directly into your lungs. Sudden shortness of breath, sharp chest pain that amplifies when you breathe in, a heart rate that spikes without warning. If those 3 things occur together, call 911 immediately. Do not call your doctor or urgent care, call 911. Research indicates that for a large number of pancreatic cancer patients, an unexplained blood clot was the very first sign of trouble, appearing sometimes 6 months before the cancer was ever discovered. 6 months. Think of how much earlier this disease could have been caught if someone had only linked the clot to the pancreas. If you have experienced a blood clot lately without a clear explanation, you need to ask your doctor directly if abdominal imaging has been considered. Do not view this as a panic reaction. View it as a responsible next step that could completely change your prognosis. You now know something most emergency room doctors don't even think to tell their senior patients. That link between a blood clot and your pancreas is the kind of information that saves lives. And the 6th symptom is one your body has already been signaling to you on a regular, repeating cycle, almost like clockwork. And every single time it appeared, you gave it the completely wrong explanation. You had a fever last Tuesday and it went away. Then it returned Thursday. You convinced yourself it was just some virus going around. It was not a bug. A virus passes. This keeps cycling back because your immune system is not battling an infection it can overcome. It is fighting a chronic disease that isn't leaving. Pancreatic cancer generates ongoing inflammation inside you. Your pancreas is swollen. Your bile duct is obstructed. Bile is backing up into areas it does not belong, and your immune system is responding to all of that simultaneously. The result is a pattern of recurring low-grade fevers that cycle in and out without ever fully resolving. You don't experience a dramatic high fever. You experience bouts where you suddenly feel intensely cold, chilled to your bones. Even in a warm home, you may shiver without any trigger. And then within a few hours, your temperature climbs, a low grade, maybe 99 or 100 degrees. Not high enough to feel like you are truly sick, but persistent enough to feel consistently wrong. And then it passes, only to return 3 days later and then pass once more. This cycling behavior, combined with night sweats, waking up damp even when you weren't hot when you fell asleep, is one of those combinations that should immediately prompt a deeper medical investigation. A fever that returns for weeks without a found infection is not a minor ailment. It demands that a doctor use imaging, not just write a prescription. Now you understand the difference between a random bug and a consistent medical signal. That distinction is what leads to ordering the correct test instead of giving the wrong prescription. And the seventh symptom is the one that accelerates every other issue on this list. Because while you have been dismissing it as simple fatigue, this symptom has been silently dismantling your body from the inside, 1 hour at a time. You slept 9 hours last night. You woke up exhausted. You blamed it on not sleeping well. That is not a sleep problem. That is your body being systematically robbed of fuel every single hour by cancer cells that are biologically hardwired to intercept every resource your healthy cells require before they can ever access it. Ordinary fatigue has a cause you can identify: a bad night of rest, a busy day, stress. And it has a simple solution: sleep fixes it. Cancer-related fatigue offers no solution. You sleep 8 hours and rise feeling like you didn't sleep at all. You rest all afternoon, yet you stand up feeling just as heavy as when you first sat down. Simple tasks that were never difficult before, walking to the mailbox, carrying groceries from the car, or walking up one flight of stairs, now require effort that feels completely out of proportion to what you are doing. Pancreatic cancer cells compete directly with your healthy cells for glucose and nutrients. While your body tries to nourish your organs, muscles, and brain, the cancer intercepts that fuel for its own expansion. You are running on less fuel than you require every hour of every day, and no amount of sleep compensates for energy being stolen before it reaches where it is needed. The result is an exhaustion that feels different in quality from anything you have known: heavier, more all-encompassing, and unresponsive to resting. If that description matches what you have felt for the last several weeks, the underlying cause warrants investigation, not mere acceptance. And the eighth symptom is the one I mentioned earlier, the one I have seen in nearly every advanced stage case I have ever treated, the one that happens in the bathroom, and the one nobody ever discusses. Here it is. Your pancreas creates enzymes designed specifically to break down the fat in your food. When a tumor blocks the pancreatic duct, those enzymes cannot travel to the small intestine. Consequently, the fat you ingest passes through your digestive tract completely undigested, and undigested fat alters your stool in very specific and identifiable ways. Your stool turns a pale gray or clay-like color rather than its normal brown. It becomes greasy with an oily film you can actually observe. It floats in the toilet bowl rather than sinking due to the high fat content, and it emits an odor that is distinctly, aggressively fouler than anything you would consider normal. This is not just something you ate. It is a direct mechanical signal from your pancreas indicating that a tumor is blocking its function. Alongside this, you will notice nausea, especially after rich or fatty meals, sometimes bouts of vomiting, and a chronic sense of heaviness and discomfort in your abdomen after every meal. And because your body is not absorbing fat, it is also not absorbing the vitamins it requires, which accelerates the weight loss. It speeds up the fatigue. It compounds everything. Pale, greasy, floating, foul-smelling stool that persists for more than 2 weeks requires a call to your physician within 24 hours, not a week from now, tomorrow. Now, before you finish this video, I need 60 seconds of your focused attention, because what you do in the next 24 hours is the only thing separating the people who catch this early from the people who do not. If you recognized even 2 of these 8 symptoms while watching this, your next move is the most important health decision you will make this year. Pancreatic cancer is not a death sentence when detected early. The survival outcomes for stage 1 are completely different from stage 4. Not slightly different, but unrecognizably different. The only variable that separates those 2 outcomes is what an individual did in the weeks after their body first began signaling them. Most people waited. Most people called it aging. Most people are no longer here to tell you that was a mistake. You are currently in that window, but it does not remain open. So here is exactly what you do right now. Write down every symptom you recognize during this video. Note the exact symptom, when it started, how often it recurs, and if it is getting worse. Then call your doctor and read that list to them aloud. Do not generalize. Do not just say you have been feeling off. Read the list word for word. Specific symptoms lead to specific investigations. Vague complaints often get sent home with nothing. And if your doctor dismisses your concerns without ordering imaging, you have every right to push back. Ask specifically if a CT scan or ultrasound of your abdomen is appropriate. You are not being difficult. You are being the only person in that room who is fighting for your life. Do not leave this video and go back to calling it aging. You know too much now to do that. If this video gave you insights your doctor has never mentioned, please hit the like button right now. It takes 1 second and it places this information in front of another senior who needs it just as desperately as you did before you pressed play. Subscribe if you are not already here. Every single week, I cover the vital health information that isn't making headlines, but is changing outcomes for people over 60. And share this video tonight. Send it to someone whose back has been bothering them. Send it to the friend who keeps insisting they are fine. You might think you are just sending a video, but you could actually be giving them the window they didn't know they had. Now, there is one thing I didn't tell you in this video, something I deliberately left out because it deserves its own discussion. There is a specific combination of just 3 of these 8 symptoms that, when they occur together, does not just suggest pancreatic cancer. It all but confirms it. And there is one single test your doctor can order tomorrow that detects this combination before it hits stage 2. Most seniors have never heard of it, and most doctors will not mention it unless you request it by name. That is the subject of the next video. It is on your screen right now. Watch it before you do anything else.